Hello students, my name is Preeti, working as an assistant professor in School of Pharmacy, BPD University. So today's topic is management of barbiturates and morphine poisoning. Earlier we have already discussed about the principles of poisoning and the principles of prevention of poisoning or treatment of poisoning. So if any kind of poisoning occur, how can we manage? So here we are going to discuss about two types of poisoning, barbiturate poisoning and morphine poisoning, and how can we manage or prevent from barbiturate and morphine poisoning. So firstly, barbiturates are a type of CNS depressant drug that causes relaxation and sleepiness. This type of poisoning occurs mostly suicidal, sometimes accidental. So barbiturate is a CNS depressant drug, but if the dose is increases, it may cause toxic effect or harmful effect. This may be occur by suicidal, or sometimes if the patient accidentally intake the drug, it may cause toxic effects. So what are the symptoms and signs of barbiturate poisoning? First, altered consciousness, that may include confusion, drowsiness or coma. Second is slurred speech, that is difficulty in speaking clearly. Third one is impaired coordination, that is loss of balance and unsteady gait. Fourth one is memory loss. It involves short-term memory problems. The other signs and symptoms are difficulty in thinking, faulty judgment, incoordination, shallow breathing, respiratory collapse or cardiac arrest led to death. So how can we manage or prevent our body from barbiturate poisoning? These are followed by step by step. So first one is initial assessment, that means evaluate the patient's airway, breathing and circulation. Second is stabilization, that is maintain vital signs and prevent complications. Third one is decontamination, that involves remove any remaining substance from the body. Fourth one is antidote administration, that means use specific antidote to reverse the effect. Last is supportive care. It involves oxygen, fluids and medications as needed. So how can we manage? These are some crucial steps that must be followed for the management and prevention of barbiturate poisoning. So monitoring of complete blood count, glucose level, serum electrolytes, creatinine, blood urea nitrogen, that is also known as 1-VUN, and urine myoglobin. Other than that, maintaining sufficient ventilation and keeping the patient warm and supporting vital body part function. We must also maintain blood pressure, hemodialysis in case of severe intoxication. Charcoal hemoperfusion or hemodialysis is required, and for long acting barbiturate, these are removed more effectively with hemodialysis than with ion exchange due to its less binding with lipid and proteins. The plasma and urine alkalinization with sodium bicarbonate, and if the poisoning effect or toxic effect is less than 24 hours, so in that case ingestion, induction of apomorphine emesis, gastric lavage and delivery of saline cathartic increases the elimination rate. So by using these methods, we may reduce or eliminate the concentration of barbiturate. While the administration of activated charcoal, as we know charcoal is a adsorbent, work as an adsorbent, results in decreased absorption of the toxic compound. So when activated charcoal is used, it may absorb barbiturate molecules on its surface, and at last it may eliminated or excreted from our body. Like I said earlier, the blood test may also perform. In the blood test, we must include complete blood count that assess overall blood health, glucose level to check for hypoglycemia, serum electrolytes to monitor electrolyte balance, creatinine, and one is blood urea nitrogen test to evaluate kidney function, and lastly blood gas analysis to assess oxygen and carbon dioxide levels. Other than barbiturate poisoning, if morphine is also used by drug abusers or accidentally or in suicidal case, it may also cause poisoning effect or toxic effect to our body. So this type of poisoning generally accidental, suicidal or seen in drug abusers. So what are the signs and symptoms? It may cause bradycardia, that is slow heart rate, and respiratory depression, which involves shallow or occasional breathing. Next one is pinpoint pupils, that involves constrict pupils, and last one is confusion, that involves mental disorientation. The other signs and symptoms are stupor or coma, fall in BP and shock, convulsions. The convulsions may be seen in few patients. Next one is pulmonary edema, and lastly death due to respiratory failure. So what are the management of morphine poisoning? Here are some points. Respiratory supports. It involves oxygen therapy and mechanical ventilation. Fluid management, which involves intravenous fluids to maintain hydration. And last one is gastric lavage for the removal of unabsorbed drug from the stomach. Other than that, we must maintain blood pressure. It can be achieved by providing IV fluids and vasoconstrictors. We may also use specific antidotes. Firstly, naloxone is preferred for morphine poisoning. It is a type of opioid antagonist which is worked by binding to the opioid receptor and block the opioid molecule so that it may not increase opioid function or opioid effect. The second drug is nalorphine. Nalorphine is a less potent antagonist and the dose is 3 to 5 mg IV. It is a less satisfactory alternative. So in last, what is the prevention? First one is safe storage. By this, store medication securely and out of reach of children. Second one is drug education. We must educate and aware patients about the risk of misuse. Last one is responsible prescribing. Prescribe medication cautiously and monitor patients closely. So that's all for today.